Hello, everyone, and welcome to the Concentra webinar, Getting the Workforce Back to Work. Today's webinar will be presented by Concentra's Chief Medical Officer, Dr. John Anderson, Concentra's National Medical Director of Medical Surveillance Services, Dr. Ronda McCarthy, and our National Medical Director for Telemedicine, Dr. Lisa Figueroa. At the conclusion of the presentation, we will have a 10 to 15-minute Q&A session with the presenters. You can submit your questions throughout the presentation to be answered during the Q&A. We will answer as many questions as possible within the time allowed. A recording of the webinar will be emailed to you after the presentation, so you can view it again at your convenience. Dr. Anderson, we're ready to begin.
Thank you. If you want to proceed to the next slide there. So we'll address a number of things on the agenda today, including the preparation for America's reopening, which we're all very interested in, COVID-19 clearance assessment, surveillance, and return to work, why telemedicine, and some information about Concentra Telemedicine. And we'll finally end up with the Q&A. So next slide. So somebody asked me just yesterday how I was faring in this fluid environment. We continuously refer to the environment as fluid, and my response was, I feel like it's so fluid I'm drowning in information. The good news is that over the last 3 weeks, we're finally seeing some decreases in the number of specimens testing positive for coronavirus nationally, the number of national ED, emergency department visits for both influenza-like illness and coronavirus-like illness, and also the percentage of deaths attributed to pneumonia, influenza, and coronavirus. So that's pretty good news. And now as the federal, state, and local governments begin to loosen the restrictions on businesses, it's really crucial to those of us responsible for reopening our businesses to prepare and move forward in a logical and safe manner. Difficult to do with all the information coming at us from all sides. But over the next hour, we'll address some of the challenges we're all facing, Concentra included, in returning to some sense of normalcy, or the new normal, and maybe some of the solutions we believe that will bring employees back to work while at the same time promoting a healthy work environment. We all need solutions that control the presence and spread of coronavirus to healthy workers, and that also promote confidence in your employees that their safety is your highest priority when returning them to work. This is particularly true for those who are vulnerable to the most serious complications of coronavirus. We've seen those on TV for the past several months. This vulnerable group includes an estimated 41 million individuals in the working population between the ages of 18 to 65 who have serious underlying health conditions. And it also includes every one of those over 65 years of age, which is a risk factor in and of itself. Identifying those employees is one of the many factors our clinicians take into consideration in the process of determining appropriate return to work recommendations. And we need solutions that are cost-effective, time-sensitive, reliable, convenient, and safe for your workers. We've been working for the past several months on different options, knowing that this time would come soon and would involve literally millions of workers returning to their jobs. We know from talking to some of you that there are many employers struggling to make decisions based on an overload of information, guidance from the CDC, World Health Organization, and OSHA that sometimes changes daily, and at times also appears to be contradictory. On top of that, the deluge of misinformation about products, tests, and programs is truly confusing at best. So we hope today to bring some level of clarity and simplicity that will make your decisions easier as you reopen your workplace. Next slide. So there are a number of different things that we and CDC recommend that are so helpful, fundamental, and yet the most important advice for strategies that can help prevent and reduce workplace exposures to coronavirus, as well as other infectious diseases. We're living in a changed world now that appreciates the advice maybe of Benjamin Franklin when he said that an ounce of prevention is worth a pound of cure. Encourage your sick employees to stay home and ensure your sick leave policies allow this. At the same time, encouraging those coming back to work to get physically prepared and conditioned for the job that they had left behind. Ensure your employees understand correct respiratory etiquette and hand hygiene, social distancing, and provide health education resources to them as needed, posted around the workplace. Regularly clean and disinfect the work environment, especially those frequently touched surfaces we've heard about on the news, doorknobs, door handles, surface tops, and so forth. And create an infectious disease outbreak response and plan to share it with your employees. That doesn't pertain only to COVID-19, but other potential infectious disease outbreaks as well, including influenza. Next slide. So what has Concentra been doing all this time to respond to the coronavirus changes upon us? Number one, starts with us at the very front door. We ask for patients entering the front door and visitors all to wear a mask. We have an enhanced clinical triage process that detects potential COVID-19 cases entering into the center that got past our front door with mandatory screening questionnaire for every patient in every center to isolate those people. We also immediately, when identified, we separate the sick from the healthy and place them in an isolation room to reduce the possible spread of coronavirus. We're cleaning and using infection control processes throughout our centers in every single room. And in the early stages of the coronavirus pandemic, we developed a coronavirus task force with subject matter experts to stay ahead of the curve with the coronavirus issue involving our centers and our patients. We've implemented testing for coronavirus. We have a new clearance assessment, which is an online or available online questionnaire for patients to fill out, which is then reviewed by our clinicians to determine whether or not they are ready to return to the workplace without increasing contagion at the work site. We perform COVID-19 RNA and antibody clearance, along with return to work testing now provided for asymptomatic employees. I'll make a point here of saying that patients coming into our centers need to be asymptomatic. We are not taking care of symptomatic patients, nor are we testing symptomatic patients. Finally, we have ongoing COVID-19 surveillance screening programs and testings that are now available. And finally, the expansion of our telemedicine program from our core telemedicine group of dedicated physicians to every one of our centers has occurred over the past several weeks. New telemedicine services that are available include COVID-19 return to work evaluations and also transfer of care evaluations. Next slide. I'd like to introduce Dr. McCarthy, who is National Medical Director for Medical Surveillance Services and also the chair of our Regulatory Testing and Examinations Medical Expert Panel. Dr. McCarthy.
Thank you, Dr. Anderson. And as Dr. Anderson introduced, Concentra Medical Centers will offer new services that are vetted through Concentra's Corona Task Force to clear your employees back to work safely and effectively while keeping our own colleagues safe. These services have become possible with personal protective equipment such as face masks and N95 respirators supplies catching up to demand. Also, Concentra now offers 2 quality FDA emergency use authorized COVID-19 tests. The new service offerings are specifically for initial clearance of workers back into the work environment, ongoing COVID-19 workforce surveillance, and COVID-19 return to work evaluation for employees with exposure to COVID-19 or return to work after presumed or confirmed illness, as Dr. Anderson just discussed. These services are all in asymptomatic employees. There's no change to our current screening protocol of triaging all patients entering into Concentra centers. Next slide. This slide outlines the COVID-19 services available to clear employees after furlough and may also be used by some employers whose employees are already working. The service package options you choose may depend on local and state mandates, employer policy, and worksite coronavirus exposure risk. The first option, the COVID-19 clearance assessment, is the most cost-effective and time-efficient option. This assessment is included in all the other clearance service packages. The next option is the COVID-19 clearance active infection and antibody initial test. This is our most comprehensive service for the risk-adverse employer. It will let the employer know if the employee their employees have active infection or have presumed immunity to SARS-CoV-2. The COVID-19 clearance antibody and clearance active infection include the comprehensive screening and either the antibody or the active infection test. If the antibody test is included, this service will not provide any testing confirmation for active infection and should not be used alone to determine if an individual is actively infected or contagious. If the clearance active infection service package is used, it will determine if the individuals tested are actively infected or contagious. These clearance evaluations may also be combined with active infection surveillance, which monitors your workforce that has returned for active COVID-19 infection on a periodic basis. Because, to point out, these tests on initial clearance only test for infection and at that point in time, only screen and test for infection at that point in time, and do not provide and will need ongoing monitoring either at the work site and with testing to determine ongoing testing for active infection. Our return to work evaluation is also available for those employees who may develop infection while at work or be exposed to be exposed to coronavirus or COVID-19 at the workplace or at home and need a return to work evaluation prior to return to work. Next slide. This solution flow chart of the COVID-19 services represents the clinical pathway for each offering and associated costs. As stated previously, the coronavirus clearance assessment purpose is to provide medical clearance of furloughed employees back into the work environment in a safe, cost-effective manner and time-efficient manner. The clearance decisions are based on employees' response to 4 categories of questions. We ask their occupational history, medical and risk factors. We ask for recent COVID-19 exposure and COVID-19 illness history. Those employees who have no health history, no risk factors, no exposure history, and no history of COVID-19 disease will be recommended to work without restrictions. They pose no known risk to fellow workers. Those employees that answer differently may be asked to come into the clinic for further evaluation or come in for a test, depending on the information provided. And so if you look at the solution and look at row A, you can see that you'll have a clinical assessment. I have assessment, which is the form with the questions that I just relayed, and you'll have the clinician review. This may go directly to where we advise work or home if they happen to have symptoms of illness or exposure, and we do not recommend they return at that time, or there may be advised for a clinical exam or specifically an RNA test or an antibody test. The B, C, and D option represent those service packages that we discussed, where the employer may want the assessment and the RNA test only, or both the RNA and antibody test. And the service package E is with an in-house examination, such as the return to work offering. If you have an employee that has had an exposure and or an illness and needs a return to work evaluation. Next slide. Let's look at COVID-19 testing options more closely. The RNA test is used to determine if someone is currently infected with SARS-CoV-2, the virus that causes COVID-19. At Concentra, we use a nasal swab to collect the specimen. This specimen is processed in a nationally recognized laboratory, Quest. The turnaround time is 2 to 3 days from date of collection. The COVID-19 antibody test is a blood test, and it's used to determine if someone's had the infection and is presumed immune. It is also processed by Quest. Its turnaround time is 3 to 4 days. Your employee can expect Concentra's medical staff to wear the appropriate personal protective equipment when collecting specimens. We also ask that all patients wear a mask while at Concentra centers. Next slide. Although Concentra utilizes thoroughly vetted testing procedures and quality laboratories, there are limitations to COVID-19 RNA and antibody testing. No test is 100% accurate all the time, but testing remains our best tool to identify an infection. For the COVID-19 RNA test, the limitation is primarily false negatives. False positives are possible, but a positive RNA test is likely indicative of COVID-19 infection. If you have a negative test, the employee or the individual may actually have COVID-19 infection, and so if they have symptoms that are indicative of a COVID-19 infection, we may want to repeat that. A positive COVID-19 antibody test indicates the presence of antibodies for some level of protection from the virus, and at least in the short term, at our present knowledge of this antibody test. How long the protection lasts and whether or not it declines over time are still unknown. A negative antibody test means antibodies are not present at detectable levels, but it does not rule out the possibility of previous COVID-19 infection. Again, false negatives are more likely to occur than false positives with the antibody test. Next slide, thank you. So about our services, employers have 520 multiple points of access to Concentra centers nationwide. Worksite options are also available. COVID-19 services can remain as a single source of care for results and reporting all delivered the same way as your current services. Most importantly, the SARS-CoV-2 COVID-19 pandemic has increased everyone's awareness on how important it is to identify and control employees' exposure risk, and for employers to provide ongoing management to provide for workplace health and safety. I will now pass the presentation on to Dr. Figueroa, our National Medical Director for Telemedicine Services, Vice President of Medical Operations, and National Medical Director for Health Information Technology. Thank you, Dr. Figueroa.
Thank you, Dr. McCarthy. Good afternoon, everyone. So this slide is entitled, Why Telemedicine? And I think in today's times, it probably is more appropriate to say, why not telemedicine? So as the COVID-19 pandemic raged across America and across the world, telemedicine became a huge opportunity for patients to connect with their clinicians. So utilization of telemedicine increased dramatically during the COVID pandemic. We know that many studies have revealed that telemedicine visits with patient, clinicians, interaction is perfectly appropriate for many visits, illnesses, and work injury alike. So telemedicine is an option to provide care to patients that were risk adverse. They didn't want to present to a center. They were concerned about potential exposure to COVID-19. Many cancellations of appointments, many no-shows of appointments because they just were afraid to see their clinician. That fear did not necessarily mean that patient did not require care. So lots of people, lots of patients out there that needed to see their clinicians were not doing so because of the fear of that exposure. So telemedicine certainly became a huge opportunity for patients to connect with their clinicians. We know in the group health space that telemedicine adoption and utilization was on the rise, especially over the last 5 years. But on the workers' comp side, a little slower to adopt telemedicine, although Concentra has been providing telemedicine care for workers' comp injuries for 3+ years now. But as the COVID pandemic raged across the world, we certainly know that workers' comp injury and many of the injuries that occur in the workplace can be, visits can be done via telemedicine, and we've shown that and proven that with Concentra Telemed. Also, that patients enjoy those visits and rate those visits highly. Next slide, please. So about Concentra Telemedicine, certainly with the COVID pandemic, the centralized core telemedicine team saw a vast increase in visits over a short period of time. It was actually a quadrupling in our visits within 3 days. So certainly the need was there. And so Concentra responded by saying, how can we provide telemedicine care in 520 plus of our centers across the nation and have our Concentra clinicians, local clinicians, provide the care to their patients, where our employers know the clinicians value their service, and this way we could provide care via telemedicine across all of our centers. So very rapidly, we were able to provide telemedicine services to our patients. That included new injuries, and injury rechecks. So those patients that were not presenting for their recheck appointments, again, because of the fear of potential exposure, were not showing up, were canceling. So we reached out to them and said, how about a telemedicine visit with your clinician? And lo and behold, it was very well received, and we started to see telemedicine visits for new injuries, for our recheck visits, introduce telerehab so that we can perform virtual visits for our therapy patients, and providing that service across all of our centers proved to be invaluable. So using Concentra Telemed is like visiting a Concentra Medical Center. The reason I say that is because we use all of our applications that we currently do in centers via telemedicine. So our practice management system is the same. We use our same EHR. The employee virtually checks into our practice management system. Our Concentra Center clinician conducts the visit with the patient, and the employer receives the same reporting and billing as they do as if the patient were physically present in a center for their visit. We're utilizing the Concentra telemedicine services in our centers nationwide during Concentra Center hours. We still have our core centralized Concentra Telemed group that sees workers' comp injury patients, and illness patients 24/7, 365 in 38 states and now including the District of Columbia. For those that need to know what states those represent, you can visit concentra.com/telemedicine. So about Concentra Telemed, we all know that not every work injury is appropriate for telemedicine. This is based on mechanism of injury. Somebody that falls 20 feet from a roof certainly is a case that may and likely not be a candidate for a telemedicine visit, but many injuries are. So we look at injuries like the grade 1 and 2 upper and lower extremity sprains and strains, our minor burns, our back strains, our neck strains and sprains, and these are without significant limitations in movement. We have our contusions without deformities. We have occupational dermatitis, our tendinitis and repetitive use injuries, our blood-borne pathogen exposures, all visits that are appropriate for telemedicine virtual care, with the same quality of care that those patients would receive if they went to a center. Again, with a local Concentra clinician that they've built relationships with and that they've known to trust. We also, as I mentioned, have rechecks and physical therapy. In addition to the telemedicine service offerings that I just mentioned, we also have COVID-19 return to work evaluations. So these are asymptomatic employees that are returning to work, wanting to return to work, but need a return to work evaluation So they have either had the illness or have been exposed to COVID-19. They're currently asymptomatic and need that return to work. These are employer-paid services that are available via telemedicine. The transfer of care evaluations, Dr. Anderson mentioned very briefly. These are workers' comp patients that have been treating outside of Concentra, but are needing care because perhaps those locations have closed and are no longer in business or have very limited hours. So we are accepting workers' comp patients in transfer, but those would have to be reviewed and approved by a Concentra physician. And once that happens, those visits can be conducted via in-person or via telemedicine. So the billing process for Concentra Telemed services is identical to our medical center process. The difference is the HCFA for workers' comp injury will have a 95 modifier and a new location code. That indicates that that visit was not in person, but was conducted via telemedicine. There are no upcharges for telemedicine services, so there are no contracts required from our current customers. There are no implementation fees for telemedicine, no coordination fees, no technology fees, and no language line fees that may be necessary for interpretation and translation services. And again, billing arrangements are the same as you would experience following an in-center visit. So how we communicate with our employers is also identical to the way it's done in center. So those current employers that are utilizing the employer portal to receive information, that's the work status, the activity status and restriction form, and the no-show reports via the portal, would continue to receive those with telemedicine visits. Again, the identical systems that we're using, our practice management system, our EHR, and so that communication to the employer is identical to an in-person visit. So all of that activity occurs via the portal, or if the employer, you as the employer, have identified a different mode of communication, we would provide it the same way, via telemedicine or in person. So let's talk about Concentra Telemed in four different categories about convenience, care quality, security, and integration. So certainly we know the convenience factor is there. Patients can conduct a visit using their smartphone, tablet, or computer. They access Concentra Telemed and have a virtual visit with a clinician. It's the same quality of care as a visit in person. The only difference is that the patient is not physically in center, but on camera. So all of our telemedicine visits are synchronous, and that means that it's both video and audio. So we're not doing telephonic visits only for workers' comp. These are video, audio, and synchronous visits. So the same quality of care is delivered via telemedicine as in person. Security, we use a HIPAA-compliant video platform or telemedicine platform. Patient records are documented in our EMR. They are not documented on the video platform. So that helps with the continuity of care. So if a patient was seen in center, all of the records are in our EHR. So if they choose to have their recheck visit via telemedicine, all of that information is available in our EHR. So video visits are not recorded. That's an often asked question, and they are not recorded on our video platform. As far as integration is concerned, again, because we have our same reporting, billing, and EMR systems, it's seamless, and that information is integrated with our Concentra medical centers. And there are no additional providers to manage. We utilize our own Concentra clinicians for all of our telemedicine services. So how to access center telemedicine. So today it is immediately available for current Concentra customers, and no setup is required. Employees must have access to a private location. It is the employee's determination of what they consider private. So if they are in their living room and they have a significant other with them and they consider that private, that is a private location. We do ask all patients if they are in a private location, and we also make sure that they consent to telemedicine care with each visit. They have to have an internet-enabled device with a webcam and a microphone. So again, smartphone, tablet, computer. To use telemedicine, an employee should call his or her local Concentra Medical Center and request a telemedicine visit with a center clinician. Once that is done, the center staff will help the employee create an account on Concentra Telemed and set up a visit for them to be seen